Bismillahirrahmanirrahim. Welcome to all of you to the pharmacology section. So, pharmacology, which is I think considered as some boring subject because a lot of students think that it's a subject of crime, just crime. But I don't think so. If you follow this series, I think you also change your mind. So, what is pharmacology? Which is you mostly define the study of drug. So I like the interesting way instead of just jump into the series. So just look at the example of one drug, then we understand why we are studying the pharmacology. So here is a situation in front of you. Situation is when you have headache, you go for taking analgesic, any analgesic, analgesic means pain relief drug. So like paracetamol. So I have few questions. You have to answer me. Number one, how many tablets do you take? 1, 2, 3, 4, 5, 6, 7, 9, 10. How many tablets? You may be thinking you mostly take 1 or 2. Why you don't take half tablet or the 10 tablets? You are thinking because if I take half tablet, don't work. I can't relieve my pain. If you why you don't take 10 tablets? Means it's maybe some cause the problem. So that's why we are not going to it. Who define what is the range of maximum and to minimum drug? So what is therapeutic drug? That is pharmacology. Another question: does it relieve the moment you take it? How long does it take to relieve the pain? Are you as you take it? Does it relieve at that moment? Or it take time? So mean there is a time for the drug have to action. Does this relief last for a week or month? Is it does it relieve for a week or month? You may be thinking it's give me relief for 1 day or 2 days or some hours. So we have to take again. So who defined the second dose? The pharmacologist. So is it safe to continue this drug for a month? You may be thinking yes or no. If I continue, it may cause some problem for my body. So this also define the pharmacology. That's why we study the pharmacology. As a doctor, do you prescribe this drug for all headache patient? If no, then why? Why you go for an alternative? Because it's dependent upon the condition. So, for example, paracetamol is not safe for every patient. For example, the hepatic problem, if some have the nephrotic problem, or we also go for the alternative. So, because continuous paracetamol for the longer period of it may cause a liver problem. So, this for all these questions we go for the pharmacology. So that's why I welcome to pharmacology study of drugs. So first in today's session I just go for the little introduction regarding drugs. Then we actually study the pharmacology in a professional way in the upcoming series. So what is drug? It's a chemical substance that stimulate or inhibit an existing cell function but do not create new one. So mean it's increase or inhibit the already physiological function that is present. So no new function can be used for the treatment. We use for the treatment for the prevention. Some drugs are for the diagnosis purpose of disease or modify the physiological process. But in the WHO that in the 1966 it gives some better definition for the drug. That is, drug is any substance, the product that is used or intended to be used. Mean we are using our concern is for the use is to modify or explore the physiological system or the pathological state for the benefit of the recipient. Recipient mean here is the patient. So we are using any chemical substance, anything. Even our food can be a drug sometimes. So anything we take because it's not actually part of our body. So it may affect, it's modifies some physiological. We have taken paracetamol like this for the headache. So it may result for the relief, it may not. So but our concern was the for some time to modify the physiological process. So, what are sources of drug? So, in the past history, mostly the plants and animal was the good source. But now we have couple of sources like minerals. Iron or the vitamins, or you can say parasulfate. All these are example of your mineral sources. Plants like digoxin, which quinine, digoxin, for example, is used for the cardiac problem, cardiac failure problem. Animal sources, heparin and microbes. So all the antibiotics which are against microbes are also taken from some other microbe. So these are the sources, and the toxin like botulinum toxin and your synthetic drugs. Your almost 95% are drugs are the synthetic which you mostly see in the medical stores. So these are synthetic drugs. So some are also drugs which are aspirin, paracetamol, ibuprofen, sulfonamide. So these are, and some are semi-synthetic. For example, morphine is into the apomorphine, heroin. Heroin is actually modified drug of your morphine, and your the ampicillin or amoxicillin. So these are modified term of or semi-synthetic form of penicillin. So these are, but the important thing is the nomenclature. So actually, when you study the drug, we use in three chemical name. We go for brand name and the generic name. So chemical name is for the important for who are going to who are going to manufacture these drugs. So for example, we take example of Panadol. Describe the atomic or molecular structure of the drug. For example, the N-acetyl P-aminophenol. That is the chemical name for the your same paracetamol or the Panadol is actually paracetamol. Panadol is what? It is actually brand name. So Calpol, Tylenol, Empow, Panadol. So these are all are the brand name for the paracetamol. So brand name are represented by actually are encircled so over the drug. So Calpol, Tylenol, Empow. So they are same drug but different brand name. And also you see the capital A. So first letter is capital Well, the generic name, which is actually name given to government approved drugs sold on prescription over the counter. So these are paracetamol. So they are always non-capital. So don't go for the brand name. We have to good idea of the generic name. Chemical for those who are for manufactured are most concerned with the your generic name. So important is no need to remember the brand name, because brand name can change from one country to other country. So we cannot memorize the 20 or 30 name of one drug. So we have to always memorize, or we have to study the generic name. So, and for now let's come to the pharmacology, that is actually study of drug. Actually, we have to divide into general pharmacology and the special. General is, it has two parts actually. One is pharmacokinetics, one is pharmacodynamics. Pharma means drug, kinetics means movement. So mean movement of drug. You can say drug is moving from my mouth, going into the esophagus, going into stomach, going into the intestine, absorbing into the blood and distributing throughout the body. This is the movement of drug. It reaches the tissue, perform its job, that is the action of drug. So that is the pharmacodynamics. Dynamics means power. What is power of your drug? So what it can do, that is the mean it's a therapeutic, that is our concern, some side effects. So that is all considered in the we study in the pharmacodynamics. So spatial pharmacology mean we study all these things in the spatial system. For example, we study the drug of the antimicrobial drugs, we go for the autonomic drugs, blood disorder drugs, serious drugs, renal, endocrine, CNS drugs. So these are all are the different chapter in your pharmacology. So toxicology, chemotherapeutic drugs, so immunopharmacology. So this is part of your separation. First we cover the general pharmacology, which is I think most important to before we start the separation pharmacology. So general pharmacology, two parts, pharmacokinetics and the pharmacodynamics. And so for this, I just give this example. Let's see, this is your part of your intestine, and here is your blood vessel. So for example, you have taken this drug. Just look at it. This is drug which is you have taken from mouth to esophagus. Mean you have from the mean you have from the mouth and it go into the pharynx, then into the esophagus, then it go to the your stomach and intestine. For example, a distal part of the intestine. So now it's going moving, and so now from this is absorbed into the your blood vessel. So this is our first stage in the pharmacokinetics. Then it's not necessarily we all drug should be absorbed by the intestine. Sometimes we give the IV, mean intravascular, that by the injections. So then in that cases our drug directly come into the blood. So like this. So no need to absorption. And after mean it's come into the blood, now it has to distribute into different tissues. Let's see, these are different tissues, they are going there. So this is second stage, distribution. Mean it's not go into one specific. It has to distribute throughout the blood because our blood is going throughout the body. So for example, it's go to the target tissue where they do the actual job, and it can go to the other tissue. Mean where there is no need. So and liver, it's going to liver, kidney. So if it's go to the target tissue, what it do? Mean it's perform actual job. That is we consider therapeutic. Therapeutic mean therapy, which mean go for the treatment. Mean our concern, that is therapeutic effect. If in the other tissue it cause some adverse effect, we consider the side effect. So if it go to the liver, so where they metabolize, and in the by the kidney, you know whether it's for the excretion problem, for the excretion. Actually, this part, absorption, distribution, metabolism, excretion. So these four steps are considered under the pharmacokinetics. So and other term, that is the pharmacodynamics, that is the effect, the power of drug. So pharmaco mean and kinetic, two words. So if you see here, pharmacokinetic, drug and movement. So what body does to drug? So that is the pharmacokinetics. Mean body what is doing? Body is absorbing the drug, then it's distributing the drug, then it's metabolizing the drug, then it's excreting. Everything is action. Subject is here body. If you look at the other condition, for example, pharmacodynamics. So what is happening in the pharmacodynamics? Drug is power. Drug is subject. When the subject is drug, that is a pharmacodynamic. When the subject is your body, that is a pharmacokinetics. So mean it applies its power over the tissue, cause a therapeutic effect. In the other tissue, it causes a side effect. So actually, the journey is look like this. Our drug come into the, for example, you have taken the paracetamol by the oral way. So it by the your the tract of digestive tract, it go into GIT tract, enter into the stomach, then for the intestine, and they absorb into the blood. So first step is the absorption, then it has to distribute into different tissues. Okay, so that is the second stage. Then the third stage, because our blood of the GAT tract enter into the liver, so where they metabolize. So where we study the first pass effect because of it's crossing the liver. So that is the third stage where they have metabolism. The fourth stage is the excretion, where mean by the kidney. So these are actually four stages of the ferment. In between the metabolism and the distribution, we can consider that is the stage of pharmacodynamics. It means it can perform after the distribution. It has to perform its action. When it has performed this action, so it has to metabolize. So we don't our body interested to remove the any chemical because it's external, so in that short period, it has to perform its job, that is studied under the pharmacodynamic. So inshallah, we our because my pattern of explanation is for two kind of people. One who are interested in the clinical one, the second who are interested in the post graduation or for the next level. So because it's very important, because you're just passing the exam, that is not an actual job. So you can cram your book, and after the exam there is no useful information in your mind. But in this platform, my preference is the clinical work. You can treat your patient, you can help your patient and perform well job in your the future. So our upcoming series will be regarding the pharmacokinetics and the pharmacodynamics. So for the pharmacokinetics, so these A, absorption, distribution, metabolism, E, or ADME short term is used. A, absorption, D, distribution, M, metabolism, E, excretion. So this is that's it for the today. So love to learn, not to earn. Thank you very much.